again, I'd like everyone to be responsible for themselves. For some reason, we can't mute everybody, and then when we try to, I get muted too. So we're just gonna put the onus on everyone as an individual. And so again, welcome to the 12th Annual International Conference on Stigma. We're at our session, our third session on leadership and development today. And we're here with Dr. Denise Wright, who is no stranger to Howard University, as she received her doctorate from HU. And she also taught at Howard in the Allied Health Sciences, Nursing, and Pharmacy for a number of years. So there may be some old colleagues on the line. And so I think somebody's saying no sound. Denise, can you hear me?
Yes.
Okay. So that might be another technical issue there from the chat. So as I was saying, Denise is no stranger to Howard University on a number of levels. She got her doctorate, she worked there. And today she is going to talk to us, and you can read more about her in her bio that's on the Hoover platform. And I, again, encourage everyone to go there to get more information and to create and to keep the dialogue going. We're gonna now start with Dr. Denise Wright and her self-care, the residual effects of COVID and how it has affected our mental health. Take it away, Dr. Wright.
Well, thank you, Ms. Baker. First of all, I am delighted to be with all of you. I've been around the Stigma conference since its beginning. I was working at Howard at the time. I also was the director for the AIDS Educational Training Center over 20 years ago. So it's been a long history in terms of navigating and dealing with people who have been in the field. The first thing I wanted to say is that I had a survey for everyone that I was hoping they would be able to fill out. The scope of today has been moved over just a little bit because based on and the context of us being, caregivers, people in mental health, people in the health sciences, we have a tendency to be overburdened and overloaded with, responsibilities, be it on the personal level, be it on, for work, academics. These kinds of things have inadvertently affected, and shifted, particularly after with the pandemic, in terms of how we even manage and do things. So I'm going to basically address the issues in terms of just basically being burnt out. And then we're going to look at some of the things that have happened over the years, a little bit of history, and then I'm going to spend a lot of time on remedies. I'm not going to, there's no way to present everything that needs to be presented on every vitamin, every mineral, everything. But it's going to be kind of like an overview of things that you could possibly do for yourself or for someone else, and hopefully may inform your practice. Again, these are things that you can see and look at and possibly look up to get additional information or whatever. So it's not going to be an all-inclusive thing, but I tried to extrapolate some of the more relevant things that we all could use towards self-care. And so anyway, I wanted to know, do we have the survey or no?
So what we're thinking, Denise, because there's a limit to the poll questions, there's only five we can put in the polling app.
Okay.
We can also just ask and people can respond in the chat.
Okay, well, I do not have a copy of the survey. So
okay.
I just dropped it off to Patricia and that was it. So a lot of that was based on things that I wanted to do in terms of what I possibly needed to concentrate on for the group, so it was relevant.
Well, we can start off the poll.
Okay.
I think that our tech is on.
Yeah, I don't know. I had to refresh my screen, and when I refreshed back in, one poll came up, and I answered it, but I'm not really sure how it's supposed to flow.
Okay, so what is the poll question, Patty?
Is, have you had any of these issues since the pandemic? If you're on Hoover, you can go into the poll column on the right and answer this. So the answers are sleep disturbance, eating patterns, overeating or not eating enough, weight gain, weight loss, temperament, or physical issues such as body pain, headaches. So you can either answer the poll if you're able, or you can put some of those in chat. And I can paste some that if they go in the Hoover chat, I can paste them into the Zoom chat so that it's easier for Denise to see.
So basically, in terms of the context of the first question, basically in terms of self-monitoring of what you've noticed over a period of time that's different. Oftentimes we have a bevy of symptoms or things that are going on that we're not sure about the cause of it. You know, headache or pain or a temperament, you know, having a short temper or feeling anxious. You know, what are some of those things that may have inadvertently affected you from the beginning of the pandemic up to now? Okay, Patricia, do we have the second question?
Sure. The second question. Oh, wait a minute. Second question. Out of this list, what concerns you most?
So basically, in terms of looking at and I meant to say that you can circle more than one, but for the first question, but for the second question, what is the primary thing that you are most concerned about? Is it persistence in headaches? Is it shortness of you know, feeling anxious? Is it, I mean, what is overall just overall temperament appears to be off, or you've gained a lot of weight? So I just want to find out what possibly is your predominant concern.
So Denise,
I can also pull it up. Sorry, I can also pull it up, I think, from the admin.
Oh,
for the
share
ones
the
that did
screen.
answer it. Hold on. Let me see, view results. Okay, for the ones that answered on Hoover, it's close between sleep disturbance and weight gain.
Okay, very good. Sleep disturbance and weight gain, that's very good. Okay. All right, so what's the next one?
The next one, sorry, every time I go out, it makes me go in a roundabout way to get back to it.
I can help.
Has anyone in the group lost persons from COVID? I think that's the next one. Although I think they said they could only load 5 polls, and I think you had 10. So let me also.
Well, we can deal with the first 5 because it's going to be, we'll be able to address some of the other stuff. So don't worry about that.
Okay, I can pull up your original too, because I do have it.
Okay, great. Because I was getting ready to go into my,
Do we want to try to share screen?
Who, me?
Let's see. I can do it, I think. Let's see.
Are you able to see the results? Let me see.
It's a screen within a screen. So
for lost persons since COVID is coming up, 63% said no.
Okay.
37% yes.
Okay.
And then The next question is, if so, do you feel that you have had time to grieve? And that one is 69% no, 31% yes.
Okay.
And then, let me make sure this, okay, now the next one on my list does not coincide with the next one on HUVA. So, all right, let me do the last HUVA one. The last one on HUVA says, what ways are your institution, sorry, what are ways that your organization or institution is trying to address, okay, now it's cutting off. Sorry. Let me find that question somewhere else. Is that even your question?
I don't know.
Okay. I think that might have been somebody else's question.
Okay. Is there?
But I can read the rest of your ones from your paper if you want me to.
Okay, that would be great. That would be great.
And they can do the chat. Okay, so
great.
Are you a caretaker for someone? So put that into the chat. Parent, child, sibling. Did we get some feedback on that one?
Mhm. Some.
Okay, well, the next one is, have you had any suicidal thoughts over the past year? Yes or no? Just let me know when you want me to give the next one, because I can't see right now, you know, how many responses you get.
A lot of people are saying no, yes, no. We're not getting like the bevy, so yeah, yes, so it's not the whole sample, so it's not a good sample, but okay, that's not a problem. What's the next question, please?
Next question. Do you have time to devote, do you devote time to self-care on a monthly basis?
Right.
Examples.
Right, I had it broken down by days or hours, but
yeah, you gave some examples like sleep, hygiene, manicure, salt bath, wine, you know, exercise, and then you said no, 1 to 5 hours per month, 5 to 10 hours per month, or 10 to 15 hours per month.
Okay. We got a yes and a no and a yes. Okay. Okay, very good. Very good. All right.
And then the next one is, do you have a regular exercise routine? Yes or no?
Okay, so I think we have a half and half on that.
Okay, I got 3 more questions. Do you find yourself having issues with breathing deeply? Yes or no?
Okay. All right.
All right. And then when was the last time you saw a primary care physician? And you had it broken down between, you don't know versus 6 months, within 6 months, within a year, within 2 years, or more than 2 years ago.
Okay, we got 6 months.
And that's primary care, not really because you were sick, but to get your actual care. I assume that's what you mean by that.
Yeah, yeah. Okay. Well,
All right. Last question.
Oh,
Do you have any chronic diseases?
wow, this is a healthy group, I'm assuming.
Somebody said asthma in the other chat. Yeah, there's a Hoover chat, so some of them are going over there.
Oh, okay, okay.
Yeah, over there, there's like a couple people said yes, and somebody said
Okay.
asthma.
All right, very good. Okay. Well, thank you so much for participating in the survey. I think we're going to get started with this. One person says, I'm curious if health scares or issues have come up after or during COVID. Okay. All right, so we're going to address COVID in terms of like looking at managing chronic disease in general and just dealing with health in general, because there's been a lot of, thank you so much, Patricia. There's been a lot of different manifestations or in terms of outcomes dealing with COVID. Some of them are rare and some of them have been very debilitating. To go back in terms of my own personal experience, when the vaccination first came out, I was very, very hesitant because of, experiences dealing in the healthcare system and what was going on. And I wanted to have some kind of sign that I was able to hang on to say whether or not I should get the shot. And it was on a Sunday morning, and I got a phone call around 11 o'clock, and the person from Howard said, Miss Wright, do you want to come in and get your shot? So I figured that that was a sign for me to go get my shot. So that's been a very controversial thing in the community. The other thing that really pushed me toward the whole thing of getting vaccinated was the residual effects of COVID in terms of neurological deficits, very unusual things in terms of affecting people's mental health, and basically presenting with psychoses, teeth falling out of the mouth, those kinds of things. So, in terms of risking all those and basically wanting to take that risk, I went on ahead and did it. So one of the things I did want to address in terms of in the context of dealing with COVID, but in general, as we go through our daily lives and dealing in our respective professions, that we must really concentrate on certain things that we need to do to take care of ourselves and not experience burnout. I know a lot of individuals in terms of my clinical practice, as well as, doing research, that people have been inundated with stress and pressure, be it with caretaking, be it with on their jobs, the kind of shift that's happened since COVID. So those kinds of things have been challenging to people. Furthermore, the incidence of what we call diagnosable mental health conditions has skyrocketed since COVID started. We have higher rates of drug use. We have higher rates of physical abuse, emotional abuse, sexual abuse, those kinds of things, domestic abuse. And also in terms of being able to deal with the issues around loneliness or, mitigating family relationships. So that's been an issue. So given that, let's kind of go back and we're going to talk about this whole thing around burnout and what we can do to kind of learn to be able to take a different approach in terms of taking care of ourselves, people in our family, our friends. And so I'm going to start with this PowerPoint. And I'm going to talk about, at first, we're talking about looking at least 3 different clusters in terms of dealing with quote unquote burnout or taking care of self. So one of the things that we need to do is I'm going to address sleep, nutrition, and exercise. Those are the main clusters in terms of things that we can do that are within our realm of control, that we can make things better for ourselves. So as you know, when we have a situation where people are on their phones, they're on their laptops, they're watching TV, has caused a lot of issues with sleep disruption and the disruption of the circadian rhythm. In my practice, I always ask people, do they have a television in their bedroom? I advise them not to have a television in their bedroom. I also advise them not to look at their phones 30 minutes to an hour before going to bed. I also tell people, do not have your phone in your room with you so that you're able to get sleep, because once the light hits your eyes and it just starts to disrupt your rhythm, your sleep cycle, it inadvertently affects you. So those are some of the standard things that I tell people. So in the United States, we have about 330 million people, 300 million. So out of those, 50 to 70 million adults have a sleep disorder. 10 to 30 percent adults have insomnia. And I've experienced insomnia, so sleep is kind of like my thing that I like talking about. 25 million had obstructive sleep apnea, and 1 out of 2,000 have narcolepsy, which is extremely dangerous because you can just fall asleep anywhere. So in terms of sleep being a public health hazard, as we become more modernized or technologically savvy or whatever it is, we have basically abandoned the rhythm of how we are supposed to function biologically. So if you're supposed to get 7 to 8 hours of sleep, but however, everything is interfering with that because you're on the phone or you're on the computer or you're trying to get work done or you're pushing the boundaries or you're working those extra hours, it inadvertently affects how you function and it inadvertently affects your health. So more than 35% of Americans sleep less than 7 hours per night, and 7 to 9 hours is recommended for optimal health. So the lack of sleep increases risk for substance use, inactivity, chronic conditions, car crashes, and work-related accidents. So research bores this out, but again, we have not attuned society to address these issues. We're a sleepless society and it's become a dangerous norm. Many patients do not seek immediate help because a lot of times people don't understand what a sleep disorder is or if they're having challenges with it. Some sleep disorders go undetected for years because many primary care physicians are not equipped to diagnose sleep disorders. So sleep and chronic disease. Diabetes is just at an all-time high. It's like between the diet and sleep, lack of self-care and regulation, diabetes is off the charts. Insufficient sleep is linked to an increased risk for the development of type 2 diabetes. Specifically, sleep duration and quality have emerged as predictor of levels of hemoglobin A1C, which is a marker of blood sugar control. Recent research could suggest that optimizing sleep duration and quality may be important means of improving blood sugar control in people with type 2 diabetes. Okay, so as a child, I grew up with my father. He was diabetic, and a lot of the things that he had to do to mitigate some of the residual effects, we had to do with him. So that included diet, our lifestyle, that kind of thing. So it was a family thing that we did in order to help him manage, his diabetes. And so you find a lot of people who have challenges with dealing with this because they are not coupled with other people, or they're not supported in terms of keeping on their diet, exercise, and doing those kinds of things. So that's extremely important. The other thing in terms of that is cardiovascular disease. Cardiovascular disease, particularly among African Americans, is inordinately high. And it's one of the primary mortality risks for African American women. So persons with sleep apnea have been found to be at increased risk for a number of cardiovascular diseases, notably hypertension, stroke, coronary heart disease, and cardiac arrhythmias. And they've been found to be more common with those with disordered sleep than those without sleep abnormalities. Sleep apnea and hardening of the arteries appear to share some common physiological characteristics, further suggesting that sleep apnea may be an important predictor of cardiovascular disease. So again, it goes back to self-care, not only the quality of sleep, managing chronic illness, but also exercise and nutrition. It all leads back to that. Depression. The relationship with sleep and depression is extremely complex. Sometimes you don't know whether it's the chicken or the egg. Sleep disturbance has long been held to be an important symptom of depression. Recent research has indicated that depressive symptoms may decrease once sleep apnea has been effectively treated and sufficient sleep restored. Again, it's all about the circadian rhythm being the foundation for our mental health. The interrelatedness of sleep and depression suggests it's important that sleep sufficiency of persons with depression be assessed and that symptoms of depression be monitored among persons with a sleep disorder. Now, the thing about depression in terms of my experiences clinically is that oftentimes people who have been diagnosed with clinical depression are oftentimes put on different types of medications, but it's usually without additional support or managing issues around self-care. And so oftentimes depression cannot be mitigated just by using psychotropics alone. You need to do other things. And one of them is, diet, getting adequate sleep, and exercise. So that's what's really missing in the health community in terms of dealing with the person from a holistic perspective. That's extremely important. Let's talk about the whole thing and the epidemic among adolescents in particular, because adolescents have been inadvertently affected by, the tech, wave that we're in now, how they manage tech, our relationship with tech. People carry their phones with them all the time. They look at them all the time. They have the dings and they respond to them all the time. Adolescents grew up on tech. They have a kind of symbiotic relationship with tech. And that's a lot of ways in terms of the way that they communicate or, utilizing these platforms to do their work or whatever. So But this has also disrupted the way that, in terms of development, I'm extremely concerned about general brain development. I've seen parents give their children who are 4 or 5 years old a cell phone, which bewilders me, because this exposes the child to, low-level radiation. It also kind of starts to affect their, in terms of how they behave, how they respond, how they communicate. And so in terms of the overall sleep thing, adolescents need at least 8 to 10 hours of sleep a night. So melatonin is high during this phase of our lives. And as with infants, as well as adolescents, the sleep is needed for the body to repair itself. Sleep is therapy. And so those who are adolescents, they're out or they're staying up all night. I've had many clients who've had their kids who have TVs in their bedrooms, and the kids are up until 1 or 2 o'clock in the morning watching TV. So in terms of this, like 2/3 of high school students report getting less than 8 hours of sleep on school nights. When I was working at one of the area high schools, it was not uncommon to see a child laid out at the desk, dead asleep, just totally asleep, because they're not getting adequate sleep. And this inadvertently affects how their development, how they function, how they think, how they process, how they digest, and everything else. So that is an epidemic. Obesity has been linked to lack of sleep. There's an association between short sleep duration and excess body weight, and it's been reported in all age groups, particularly pronounced in children. If you notice, a lot of children are overweight. So not only it has to do with general lifestyle, lack of sleep, but also with nutrition and lack of exercise. A lot of the exercise programs in our public schools have been eliminated and or diminished. So children are not getting the same rate or level of exercise that we possibly got when we were at school. So sleep in childhood and adolescence is particularly important for brain development, and insufficient sleep in youngsters may inadvertently affect the function of the region of brain known as the hypothalamus, which regulates appetite and expenditure of energy. So this is like a chart in terms of what kind of hours you're supposed to get in terms of your developmental age. And the older we get, the less melatonin we have, and we, have the proverbial 7 to 8 hours. But for like a newborn or an infant, they may, they're supposed to sleep, 17 to 15 hours. Toddlers, 11 to 14, preschool, and so on. So that's really, really important. So, so now we're going to address the issue around digestion and how we eat, how our gut functions as our second brain. One of the things around the way that Western culture has not addressed a lot of the things that are normal functions or biological functions for us. We do not have adequate education around these issues unless you're in the field, but also just in general, how we approach just the whole overall thing around our own personal hygiene, how we eat, and all of that has been distorted through a lot of propaganda and, processed, the whole advent of processed foods. So in the 20th century, the whole thing around processed foods came about. A lot of that had to do with, just uneven distribution of food, particularly around World War II. There were a lot of issues around getting food, the food supply, and that kind of thing. And processed food came on the scene because they needed to feed so many people. And so they started doing these modifications to the food so that people could have some kind of sustainability with regard to shelf life in terms of food consumption. But once they found out that was going on, then, you know, people said, geez, we can make money off of this. And they really started to ramp up the whole thing around processing food. And there was a big marketing campaign that were particularly targeted toward women at the time for having, you know, this kind of thing and cutting out all the housework and the cooking and that kind of thing. So it just kind of snowballed from there. And now we're at the crossroads where we're going back to where we were before in terms of looking at more of a plant-based diet, looking at organics and that type of thing. But again, that's the way we were before. So the new ingredients, appliances, you know, swirled around this whole thing around food processing and got into spray dyeing, evaporation, freeze drying, and the use of preservatives. And I remember when I was coming up, like having a TV dinner was such a big deal, you know. So you know, the whole thing around that was, you know, a thing of glamour or, you know, stepping up or being middle class or whatever. So the marketing campaign around that was extremely effective. So, you know, you got the microwave, you had electric appliances, and you had all these other kinds of things, you know, frozen dinners, instant noodle cups, baking mixes, and more. So, you know, again, a lot of people don't even know how to make stuff from scratch anymore, because they're used to like just going to the store and just getting some cake mix or cake that's already been done, which has a lot of additives in it. So processed foods were fast and affordable. And then they started questioning nutrition. Hello. Yes.
Yeah.
Okay, now you playing white elephants, you know that.
Hello.
Please mute yourself. Please mute.
So anyway, basically, this is where a lot of the preservation processes came in, and the vitamins and minerals of the food began to be stripped from the food themselves, and preservatives and the long-term health effects started to crop up. And, you know, there's this whole big thing around obesity. Now, obesity is turned out to be a global issue. And particularly like in the UK, people have just ballooned. Here in the States, people have ballooned. And so we're talking about first world countries, you know, the modern, the Western culture, how, you know, people cannot manage their weight. And a lot of that has to do with the supply chain and how we prepare our food. So one of the things about our digestive system is that it absorbs nutrients into the bloodstream, and it's necessary for energy growth and cell repair. So each nutrient that we take in plays a crucial role in overall well-being, and our body is always trying to go to maintain a state of homeostasis or balance, okay? 70 to 80% of the immune system is located in the gut. So it's important to have a majority of the immune system it's important that a majority of the immune system in the digestive system is the first encounter. So anything that we put in to our bodies is inadvertently going to be affected by that system. So eating inflammatory foods or having chronic stress triggers an immune response, which causes inflammation in the intestines. Unmanaged digestive inflammation increases intestinal permeability and, you know, leaky gut. I didn't know what it was when people were first talking about it. I'm like, what is a leaky gut? But yeah, so that's basically what it is. The intestines to inability to absorb the nutrients and to and it permeates, and it's not unable to permeate the intestinal wall. So having the right balance of microbes as part of your microbiome, which is our intestinal tract, keeps the immune system strong and healthy. Studies show that up to 90% of all diseases can be traced back to the gut microbiome. Okay, so when we talk about the microbiome, we have that in terms of our bodies itself, but the gut has a special composition, and it's like helps to manage a lot of things with regard to the way our body functions. So throughout our lives, we shape our own microbiomes. They change depending on our surroundings, as well as the things that we eat. So we can be very reactive to foods, and it can be very reactive in terms of how we sleep, as also our level of stress and our use of medications, such as antibiotics. So bacteria play a role in boosting immunity and keeping our digestive systems running smoothly, balancing our hormones, and keeping our brains working properly. So the gut produces serotonin and other neurotransmitters. So gut-friendly bacteria can help to manage neurotransmitter activity, which makes them natural antidepressants and anti-anxiety organisms. So again, with the things that we put into our mouths, what goes into our digestive system inadvertently affects how we present. It can affect our mood. It can affect the way that we think and that kind of thing. So that's why we really need to look again and see how we're managing this. Okay, so what disrupts your gut health? So pro-inflammatory foods. Now, I know that me, as well as others, I like Cheetos. That's synthetic food. Eating overly salty things that are pre-prepared, processed foods have a lot of sodium in them. This is gonna just kind of have the whole body off balance. Even for the past 2 weeks, I know that my body is off because I've been craving sugar and I've been eating it every day, but I know when I'm in balance because I don't crave sugar. So, being self-aware in terms of what you're craving and what you want to eat and what you're putting in your mouth is going to kind of give you some kind of indication about what you're going through. So comfort foods release endogenous opioids in the brain, similar to properties of narcotics that narcotics release, like, a pleasure response in the brain. So when we talk about comfort food, we're talking about mac and cheese. We're talking about, sweet potato pie. We're talking about, that's why it has its own moniker, comfort food. Things like antibodies and hormones disrupt the digestion in the gut. Because antibodies, if you take antibodies like amoxicillin or those kinds of things, it can disrupt your gut bacteria. Things like artificial sweeteners have been known to be mood disruptors. Baby formula can be the genesis for allergies and gut issues because a lot of times babies cannot process the milk or whatever, particularly on some of these formulas, which are sometimes heavily laden with sugar. And I'm not clear exactly on what kind of monitoring is done in the food chain in other countries other than the US, but it's not as stringent. So, opting out to have these formulas within lieu of breast milk has not been the best choice unless you cannot produce milk. So people do look for other alternatives. And that's why now we have things like almond milk, oat milk, and things of that nature. Okay, so the SAD diet is the standard American diet. And one of my professors talked about how the standard American diet is the Big Mac to Zantac to Prozac. And that's how much, the food that we take in, how we function is affected by, what we put in our bodies. Okay, so the gut is, the microbiome has a bidirectional relationship between the first and the second brain, meaning that what we put in our mouths, how we digest, does affect the way that we feel. It does affect our mood. It can affect our levels of anxiety and that kind of thing, because we do have a tendency to be sensitive to all kinds of things. And I'm going to get to the gluten sensitivity factor and some other things with regard to dairy. Digestion is a north and south process. The small intestine absorbs nutrients into the bloodstream. The large intestines prepare for elimination of waste from the body. Digestion occurs in the parasympathetic state of consciousness. So basically, it should be something where the body is relaxed and the body is able to eliminate, waste from the system. Poor digestion has been found in people diagnosed with mental illness. chronic stress is the foundation for inflammation, and stress can slow down the digestive process. So if you're in a state of hypervigilance, if you are functioning up here, then your body's not going to be in balance, and your body's going to function like it's ready for something. It's ready for attack. It's ready for something. So once you stay up here, it's going to affect every other thing that you're doing in terms of, what you're eating, what you're craving, and how you're digesting. So we're going to talk about now burnout signs. And like I said, this is not a roadmap to all the different things. It's kind of like all over the place, but these are some of the things that people, may notice about themselves or about others, or maybe have experienced in the past, or will kind of give you some insight about where to look and how to do. So some of the burnout signs may, first of all, in terms of the brain, a healthy brain does not have cognitive decline. So people say, oh, they're getting older, I don't remember, that kind of thing. I know a lot of seniors who are much older than I am, whose minds are clear, their retention is clear, and everything else. And I know that my mother, she died like 6 years ago, but she had a number of strokes. But the thing is, she could remember so much stuff or things that just happened. So her short-term memory was not affected, and she was very, very clear, and she had a very clean diet. So, but again, a healthy brain does not have cognitive decline. The other thing you have to remember is state-dependent memory. So memory is held in the body in a dissociated state. So the importance of knowing that is that oftentimes it shows the link between the state of our body and our emotional state, okay? But then this is like really relevant among people who have experienced, trauma or abuse. And that understanding and knowing that, you can begin to be on the road for healing. So there are two pathways for anxiety. Anxiety is one of the more prevalent. Anxiety and depression is one of the more prevalent conditions, mental health conditions that people experience. We have the amygdala and we have the cortex. The amygdala is more of the primal part of the brain, where it does not process things like it does in terms of the cortex, which is part of our executive function. And the amygdala is part of the fight or flight. The amygdala is able to sense when things are going on, and you will react oftentimes to something before you can even process what is happening. So the amygdala, in terms of the disruption, has been associated with things like phobias and PTSD. And for the cortex, has been associated with things like obsessive compulsive disorder and general anxiety disorder. So that's one of the things you have to be cognizant of in terms of the importance of how the brain functions and how we process information. One of the things I really like about this is that the human body is the most wonderful thing. It functions in such a way that it's always trying to protect us, and it's always trying to be in balance. And you always have to think about that when you're approaching your self-care regimen and when you're investigating things that you could possibly do. Now, hyperventilation, we talked about that. That was in the survey. Hyperventilation is the physical side of chronic anxiety, and hyperventilation is estimated to affect 10% of the general population. A lot of people are unconscious about it. So what I would like for everybody to do is try the hyperventilation test and find out whether or not you get able to hold your breath for more than 30 seconds. So can we do that? Can we start? Okay, I haven't started yet. Okay, so let's try it, and then put in the chat if you can make it, all right? So it's 3, 2, 1. Go. That's 30. Did everybody make it? Put in the chat if you did. Okay, we got a healthy group here. I love it. Yay. Yes, barely. That's me. That's beautiful. We got a healthy group. Everybody exercises. Everybody's on the case. Yes. Yeah. I was barely pushing. That's right. Barely pushing it. Yeah. Beautiful. Yeah, so that's one of the ways that you can, in terms of when we have the shallow breathing and stuff, it kind of keeps us in a state of, anxiety and stuff. And that's when they talk about, the deep breathing exercises, or, to kind of decrease feelings of anxiousness. Deep breathing is indicated, but we'll talk a little more about that later on. Okay, so this is like, different things that I wanted to put out there, and they may be relevant to you, they may not. But in terms of acid reflux, which is something that you see on commercials and they talk about all the time. Well, oftentimes people like with PTSD, there's a higher prevalence of acid reflux among people who have experienced a PTSD. Proton pump inhibitors are used to decrease acid reflux, often associated with cognitive decline and dementia. A lot of that has to do with the residual side effects of taking the medications. Adrenal stress, when your adrenals are, when you're stressed out and it is affecting your adrenals, that's usually indication of puffiness around the eyes or dark circles. When you go to the doctor and you're feeling anxious or whatever, a lot of times they may give you Valium or Xanax or Librium or whatever. However, these are drugs are very concerning to take because they have a tendency to be become physically dependent on them. Obsessive compulsive disorder is a sign of an overactive left brain, has been found to be signs of an overactive left brain. People with PTSD often have low cortisol levels in the morning. Autoimmune disease has been found to be prevalent among women with complex trauma. Loss of smell and failure to differentiate can be tied to dementia risk and early mortality. Bad breath is oftentimes a sign of fermented foods in the colon that have not been digested. And NSAIDs and aspirin affect the liver and the stomach. Okay, so gluten is a family of proteins and grains. So type 1 is celiac disease, which is an autoimmune disorder. You hear a lot about gluten-free, 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 gluten-free. I hadn't heard about anything with gluten-free. I think maybe over the past 10 years about being gluten-free. I think a lot of that has to do with the processing and the way things are being processed, that people are becoming more sensitive. And I think, our general sensitivity because of all the toxins that we encounter on a daily basis has caused the body to be highly sensitive toward a lot of things and how we digest things. So type 2 is non-celiac gluten sensitivity. So all of these include wheat, barley, rye, bulgur, couscous, and barley. So you may experience, bloating, it'll affect your mood, it slows you down, that kind of thing. So in terms of gluten sensitivity, these are some of the things that they're talking about. Casein, milk products, cow's milk. That's always been a big discussion in the community about, can we, properly metabolize cow's milk and people being lactose intolerant. Studies show that African Americans and Africans and Asians are 80 to 100% lactose intolerant. African Americans and Mexican natives are 70 to 80% lactose tolerant, and Northern Europeans are 1 to 5% lactose intolerant. So a lot of the things that we have with regard to how we eat and what we drink has often been driven by marketing, lobbyists, in terms of what's being put on the table. Sugar is a real big thing. The soda tax, not dealing with the soda tax, that kind of thing, because people want to make money. This is a $1 billion business, the agricultural industry, and people want to make money. So along with processed foods or sodas or whatever, those are some of the things that can inadvertently affect our system, but we're always presented with a false choice because that's the only thing that they're offering. So that's a big problem. Significant evidence establishes casein and gluten sensitivity in people with mood disorders, anxiety, depression, schizophrenia, and bipolar disorders. Okay, chronic pain is comorbid with depression. It has a bidirectional relationship. Pain is also related to the excessive use of poor quality fats. So we're talking about your trans fats. You're talking about, and I call them superficial foods, not real food. So trans fats, the rate of elimination can be tied with mental health issues such as physical and sexual abuse. People talk about, in the clinical practice, these are some of the things that you may look for in an individual, and you always ask them about, their elimination practices, their sleep practices, and all those other kinds of things, because that can give you an indication of what's going on with that person clinically. Poor elimination or not eliminating at all on a daily basis is also an issue. A person should be eliminating at least 1 to 3 times daily. A leaky gut is damaged intestinal barrier, it's undigested proteins. Our drive for carbs. Carbs are like a function as a sedative. That's why people say, I got issues getting off of carbs. A lot of that is the breads, and the breads have, the gluten in it, and it makes you feel good. And, I just can't get enough, and I want bread and butter and that kind of thing. Refined carbs and sugar are related to GERD. Vitamin D deficiency is significant in the US, particularly among African Americans, because our skin, our skin has a tendency to deflect the sun, and it minimizes absorption. So oftentimes you have to supplement. The lack of vitamin D is associated with depression, pain, and and building up the immune system is needed for that. So let's deal with remedies. And these are not the end all be all, but they're little things that you can do to kind of take a different approach in terms of self-care and how you manage and have a different, paradigm shift in terms of how you approach cooking food, how you approach your sleep, how you approach your exercise regimen. Okay, so when I say the ancestral diet is the best diet, there's people all over the world have different diets, and it's usually reflects where they live, the regions that they're from, in terms of the foods that are available. Once that is affected, once that's modified, we get into a whole different thing. When I lived in Africa, I was alarmed by a lot of the things that were going on, because a lot of things from the Western, in terms of the Western market, the foodstuffs and things of that nature, they began to flood the market in all areas of Africa in terms of, like stuff like potato chips and, your processed foods, your trans fats and things of that nature. People oftentimes have a perception that because it's from the West, it's better, and they choose that over their own product. So if you put a Planters peanuts and peanuts from a local farm in front of somebody over there, they would choose the Planters peanuts. So, you know, it's a very interesting thing. But our ancestral diet is the thing that has gotten us through millennia. And the more we step away from that, the more sicker we become. Improving our digestion improves well-being. Traditional medicine is practiced by 80% of the world population. So a lot of people utilize a lot of indigenous practices, not only in the preparation of their food, but the herbs they use. Approximately 20% of the US population uses herbal medicine. And because we have an overly acidic diet, the vegetarian diet has a tendency to bring us to more of a balance in terms of the acid alkaline balance. So, you know, looking at a plant-based diet for a while to put your body back in balance is really important. Okay, so there's certain things that you should look for when you're going to buy herbs or whatever. If you go to the Chinese market, you have to be aware that there's not as stringent in terms of standard, in terms of quality. So when they're shipped over from China, when you go to the market, a lot of these products are adulterated. They have like toxins in them or other things that are not even supposed to be there. So you'll always have to try to get things that have been, you know, under US standards in order to get, you know, a high quality type herb or fish oils or things of that nature. Avoid hydrogenated or partially hydrogenated products because that can impair immune function. Prepare fresh food daily. So gathering and preparing food activates the parasympathetic system and promotes relaxation, attachment, and connection. Preparing food is a therapeutic process. It gives you a sense of control because you know what's going in the food. The way you prepare it is the way that you like it, you know, and it gives you a sense of empowerment when you prepare your own food. Approximately 50% of the population have a reaction to nightshade foods that can promote inflammation and stiffness. So that's something like, you know, eggplants, tomatoes. People are sensitive to some of those foods. So you have to be aware of what your body may be sensitive to. The 5 most important herbs for mental health are saffron, bacopa, rhodiola, kava, St. John's wort, and licorice. The brain itself is fat and water, and it's good to have good fat. So we're talking about avocado oil, olive oil, coconut oil. Having those things in your diet is very, very beneficial. I personally, you know, use, like I'll take like a tablespoon of coconut oil, you know, the organic coconut oil. It's been hardened, but I just eat it because I need to have nourishment, not only from on the outside, but on the inside too, because my body, you know, my skin has a tendency to get dry. So I try to have a decent level of intake of healthy fats. Eggs help memory. Turmeric, which is something that you've heard about, it's a powerful anti-inflammatory. People say, you know, use turmeric, but if you use turmeric, you need to mix it with black pepper, and you need to mix it with that. So you'll be able to absorb it into the system. Sedatives and nervines are like passion flower, hops, and valerian. I use before I go to bed because I do have a tendency to be insomniac. I use hops. I got the tincture of hops, and this is what it looks like. The tincture of hops. So I take a couple of 2 or 3 drops of that before I go to bed, just to kind of settle me in. Valerian root is good, as well as passion flower. There are things that you can get with all 3 herbs in the same mixture, like for a tea, which is really, really good. Aminos are precursors to the production of neurotransmitters. Amino acid therapies are sometimes used in lieu of psychotropics. Again, we don't forget about the aminos. The aminos are very essential in terms of our general diet, and you have to be mindful to get, you know, adequate amounts of of your aminos into your diet in order to promote, good brain health and for overall body function. Seaweed kelp helps to bind toxins, metal, and it's rich in minerals. Brown seaweed is for toxification. So for those people who have been exposed to different things or natural disasters or worked in factories or been around construction sites or whatever, it's good for you to start incorporating that into your diet to kind of clear your system. Because a lot of times stuff does not go anywhere. So you really have to be really cognizant of trying to, clear your system and, getting into a regimen where you just have a restricted diet in order to feel optimal and to, put your body back in balance. Licorice tea is good for smoking cessation. Basil is an immune booster. You can eat it 3 times daily. You can eat it raw. It's good for the immune system. Milk thistle, I'm sure you guys have known about that, as a liver detoxifier, and it can be used for alcohol or drug abuse, hepatitis, or exposure to chemicals. Other detoxifiers are onions and garlic. They're sulfur-rich foods. They help with that. Recovery from excessive alcohol use. So the combination is carrots, celery, and beet. This helps to clear the system. It helps to balance out your liver, and it helps to clear the, help the body, put the body back in balance. Bitter greens aids in digestion for the liver and the gallbladder, which helps to emulsify fats. So bitter greens also is very, very helpful to eat. And again, it's like a detoxifier. These are things within our natural environment and the food chain that we can utilize to help heal ourselves. Adding bitters after a fatty meal helps with digestion. Fermented foods are essential for health of the intestinal tract. So people talk about kimchi, sauerkraut. I haven't eaten sauerkraut in so long. We used to eat sauerkraut all the time. Growing up, and I'm sure others who have lived in, it's family time or people prepare the food, or your mother, your grandmother, whatever. Growing up, you may eat certain foods like okra, sauerkraut, all those kind of whole foods, which, helped you with your growth and development. These things are extremely essential. But once you step away from that, it becomes a different story. The other thing about food is chewing your food at least 50 times. Now, that's debatable. I tried it. It took too long, but I really try to be mindful of that because that also aids in digestion. A lot of us, we're always in a hurry and we're gulping down our food. That also disrupts the way we digest our food and the kind of nutrients that we're getting. The body can only do so much. All right, so in terms of the exercise, aerobic exercise, things you do like for running, endurance, or being on the Stairmaster, for heart conditioning and endurance. Aerobic exercise is also good for anxiety and depression. I also tell people all the time if they're feeling depressed or they're feeling anxious and stuff, get into the gym or take a long walk or, jump up and down or do some things to kind of like reconstitute your brain, reconstitute your body so you feel like you're getting back to the imbalance. Anaerobic exercise is good for muscle strengthening and weightlifting, as well as resistance training. So anaerobic activities are good for body image, dysmorphia. One of the interesting things about using all this tech in terms of like Zoom or what have you, is like people have developed dysmorphia. They're like concerned about the way they look. They have this type of thing where they're looking at themselves on Zoom or Teams or something. And, that's been another outgrowth in terms of the mental health issues that people have been experiencing. I found that very interesting. But also for balance, cognitive function, and decreased dissociation from your body. Tai Chi is moving meditation, is good for energy, and interval training is a potent antidepressant. So interval training is like if you on a treadmill and you're on the treadmill so you run for 3 minutes and you walk for 2. You run for 3 minutes and you walk for 2. So it's very effective for reducing anxiety and depression, and it's also the most effective for dropping weight. I personally like, the weight, but that's just me. Core work, Pilates. It's good for ego strengthening, back pain, core posture, and emotional flexibility. Meditation, yoga increases level of GABA in the brain. GABA is a natural tranquilizer. It's also good for recovery, PTSD, balance, regulating breathing, and working out before 3 p.m. is known to be the most optimal time to exercise.
Everybody, please, if you can check your mute button again, because we're hearing background noise.
We're almost done.
I think you'll have to put, because it sounds like her phone is in her pocket or something. Thank you.
The other thing that I always tell people is that if you find the whole thing around, eating daunting, just going back to your regular vegetable stews, broths, like chicken broth is extremely good. It has the collagen, it has all the accoutrement that, help you put your body back in balance. Your brain loves it. It's easy to assimilate into the system. So I always tell people, just deal with bone broths or chicken broths, that's good. And just making a big pot of that will help you in terms of kind of like staying on track. And collagen does support, all the areas of the first brain and the second brain. The other thing is water. We have to hydrate. A lot of people are dehydrated, period. The human body is composed of 60% of water. Our brain needs water. We don't get enough water in a given day. And that's extremely important for digestion and feeling and grounding. Consistent and hydration is good for reducing pain. It promotes mobility and it lightens the mood. A lot of people who don't drink, they have headaches, they may feel dizzy, that kind of thing. So it's really, really important to be mindful of drinking the water. So you're supposed to drink like 30 to 50% of your body weight in ounces for hydration. So for example, if you're 150 pounds, you would drink 50 to 75 ounces of water. So that's really important. So the last thing is about the sleep, the circadian rhythm. People use melatonin. Cherries and chamomile is a good thing. It's good for a smoothie for you to have for work before going to bed. Going to sleep on the right side quiets the left side of the brain. That helps out a lot because oftentimes the way that we sleep depends on how we move throughout the different waves of sleep and what kind of quality of sleep that we get. Blue light or blocking glasses enhances serotonin release and enhances sleep. So again, I always tell people either put on the blue light on your laptop or your computer, after 8 o'clock, so your brain can kind of calm down and not have a disruption of the melatonin. And the last thing is in terms of utilizing touch. Acupressure is therapeutic. If you live alone or you're funny about people touching, it's very, very important that you learn to massage your legs, your feet, your scalp, those kinds of things. And that helps you to calm down and really affects, your degree of anxiety and feeling disassociated. So touch is extremely important. So that's it for me. I'm waiting for questions.
Do you want people to put it in the chat?
Yes.
If you have any questions, thoughts, concerns, please put them
Or
in.
they can also come on speaking as long as it's not all at once.
Okay, that's fine.
You want to stop sharing your,
Yeah, sure.
and then you can see this. Oh, somebody's raising their hand. Ryan. Do you want to unmute?
I'm trying. Give me a second.
Oh, no, I
Can
was
you hear me?
talking to the tech people. I think they know
Oh.
that. They mute you guys.
Can you hear me?
Yes.
So my question was like, because obviously like I deal with depression, I'm HIV positive, like I have the acid reflux. A lot of what you said like hits all those notes. Like what can I do with my diet? Because a lot of what I eat and what I'm able to afford is not good for me. Like I can't afford organic foods or things like that. So what are my options, or what would you suggest?
Well, the options are, in terms of, do you have any farmers markets around or no?
Very little. I know we've had it, but due to COVID and stuff, you're not seeing a lot of it in Louisville. I'm in Louisville, Kentucky.
Okay, so first of all, I would suggest, first of all, to try to just eat as many whole foods as possible. I mean, not everything can be organic, but if the food is prepared, properly and you wash it and all that, I think that's really important. The second thing, in terms of depression, when we were talking about the different things that you can do in terms of not only what you can eat, but just getting at, how are your sleep patterns?
I'm actually getting ready. My doctor suggested a sleep study because I think I have sleep apnea because I'm having like
Okay.
a lot of sleep disturbances and stuff. So literally everything you talked about was like, you hit
Right.
home like everywhere. So.
Right. So one of the things, like I said, one of the things that you can do is, like I said, in terms of looking at the whole foods, the other thing, like I said before, is having like broths and stuff like that. Making a giant pot of chicken noodles. So even if you can't cook, you can find somebody who knows how to cook.
Yeah. I like cooking. I've actually, since COVID, I've learned how to cook.
Really?
COVID has taught me that.
Just
Yeah.
having a great big giant pot of chicken noodle soup is really, really good. That will help put things in balance. Making sure you're hydrating. I don't know how much medication you're on because, that taking the medications does have residual effects on your system.
Yeah.
So you have to make sure that you're completely, you're flushed, right? The other thing is ginger root tea is very good also for you, for your digestive tract. That will help out also. What was your other question?
That wasn't really a question, but even with you saying the medications, like I'm on Biktarvy, and that's caused me to like, I have high blood pressure, which is near on 37, and I've also started to go pre-diabetic, but I ate pretty healthy before all of that. So it's causing a lot of, like you said, issues.
Right. So, so like I said, incorporating different things and regulating your blood sugar, such as, cinnamon, is good for that. And just try to incorporate the different like spices and herbs everywhere that you can. Try to get adequate sleep. And again, the medication is so hard to deal with because what are you going to do? What are you going to do? How are you going to mitigate that? So the only way to mitigate it is through, diet and self-care. That's about the only way. I mean, I'm not in a position, I would never tell you, oh, don't take your medication. You can't do that. So all you can do is basically try to push the envelope in terms of doing more of things with regard to your diet and your digestive system, making sure that you're hydrated. Are you thirsty all the time? How is that working? Why did they tell you they said you were pre-diabetic?
Yeah, I've already started going into pre-diabetes. It's literally, they said it's a side effect of the Biktarvy.
Right.
Like it's just something that it's doing to me. It's pushing me into pre-diabetes, which I'm trying to switch medications. I'm working on that now because it's like, it's just not working for me. It's causing sleep disturbances. I'm having mood swings.
Right. Yeah, so the other thing is like, try to talk to your doctor and see what other things that you can do in terms of the medication, because if you're taking the medication and you're doing all these other things for self-care in terms of changing your diet and stuff, that's difficult for you to balance. Mm-hmm. But you got to get some sleep, man. You got to get some
I agree.
sleep. So try, like I said, try that trifecta, try the The valerian root, I'm always screaming about valerian root, which is a calmative. The hops, like I was telling you before, this is like a drops that you can get, and passion flower. But they usually can come in a tea. Go to the health food store and see if you can get it. Take about an hour beforehand and try to load up on that. The other thing is magnesium. Have you had a blood panel?
I've had, so I can't read them all, but yeah, I mean, I just had one a few days ago. On November 1st was my last one.
Okay, so just check to make sure that you're what's going on with your magnesium and stuff, because a lot of times, disruption is all because of low magnesium and your potassium levels. And that also is for the high blood pressure too, the hypertension. Because I'm hypertensive, but I'm genetically like that. I mean, our whole family is, tense.
Got the hypertension.
We all take, I was diagnosed at 23. Okay, so I'm just saying, this is like, I'm running around with my bones, but for you, for your body to be going through these changes because of the medication, that's just one of the things that you can just try to modify with the type of medication that you're taking, and try to.
Well, see, they put me on trazodone, but the trazodone, if I take a trazodone, I'm out for like half a day or longer.
Yeah,
like I don't even like them. Like I'm out. Sometimes I'm out the whole day. Like,
dude,
they just like, here's another one.
You don't even know how that's interacting with your betarbine, the other medication that you're taking.
Mm-hmm. I fired my HIV doctor. I'm currently like waiting to find another one.
Right.
I wasn't happy. I felt unheard, and I was like, "This isn't working. Like, you're not making me a part of the medical team, and what I say matters." And they weren't listening. So
right, and then that's when you got to find another physician. Period. So please just try to get to sleep. The sleep is really important. And if I were you, just try to double up on, just make sure you drink the teas. They should be reading and going over your blood panels with you to see if there's any issues with any of your minerals and your vitamins and things of that nature, because you're supposed to know this stuff so that you can help yourself, so you need to know those things. And then once you can get that information, then you can look the stuff up, and I'm always around somewhere, but utilize as a guide to see, what else that you could need to do.
perfect. Thank you so much.
Okay, thank you.
I don't see any more questions. Patty, you see any on the Hoover side? I don't see any in the chat side.
Really, somebody just said to Ryan, what about the, I don't know, it says INJ Cabenuva? I guess it's some type of supplement. I don't know.
Oh,
I don't know that one.
I did see somebody talk about Misfit.
Oh, she said it's an injectable, some type of injectable. I don't know.
Oh, but also somebody gave a request,
I see.
a recommendation for the Misfit vegetables, which I always see, or the ugly vegetables.
Oh yeah, I was gonna mention that ugly vegetables.
They're a little cheaper, but they taste just as good.
They're just as good.
And sometimes
right.
Oh, somebody else, Ryan, was suggesting, I guess, a different HIV medication.
Right.
Yeah, that's the new injectable. Sorry, I didn't realize.
Oh
that.
Man,
I was like behind the times on the name.
Yes. Okay. Well, do you want to wrap it up or give people your contact info, or you have an email address you want to share in the chat?
I'll put it in the chat.
Awesome. Well, I'd like to thank Dr. Denise Wright for this awesome self-care moment. Made me question what I was eating, what I'm going to eat tonight. I was like, ooh, is that a good choice? I don't know yet. Denise's, Dr. Wright's information is in the chat for you all to stay in contact with her. Thank you. And we'll make sure we put this in her profile as well on the Hoover app. so we can stay tuned. And then Patty, do you want to tell people what's going to happen tomorrow morning?
Ooh, tomorrow is a very busy day. I think Lisa's coming on at like 8:45 to welcome us. And then we go into sessions all morning, including a poster session. And then in the afternoon, we have our breakouts, which are always popular. So we have 3 different choices at 2 o'clock, and then we come back, and then there's 3 more choices at 3:40. And then in the evening, we have a faith-based session, 6:30 to 7:30 as well. So we're definitely going to be busy tomorrow.
Ooh, action packed. So set your agenda,
Yeah.
everybody. Definitely click on what you're going to attend tomorrow and get your reminders. I love this app. All right. Well, have a great evening, everyone.
you.
And we'll see you tomorrow. Thank you again, Dr. Denise.
Thank
Bye, Patty.
you.
Bye,
Thank
everybody.
you.
Thank you.
And everybody out there.